Welcome to Candid Conversations with Dr. Mayfield. This episode is sponsored by Mayfield Counseling Centers, helping you find clarity, hope, and purpose. Call us at 719-452-4803. Here's your host, Trever Shirin.
Thank you for joining us on Candid Conversations. I am thrilled to be here with one of our clinicians, Stacey Hind, and of course, Dr. Mayfield. And today we are going to talk a little bit about life changes. And I think in order to have a good conversation about that, we kind of need a working definition of what life change is.
Yeah, right. So I think we all can experience it at some point in our life, and it is going to impact something that we find to be normal in our life. So something that makes a big change, maybe in physically or emotionally or maybe even spiritually. So maybe it's like a change in a relationship that you've had that's very important to you. And so I think that's how I would define it, something that's been a major change in your life. Maybe it's a life phase change, which we all experience, right, at some point of our lives.
So like, for some, moving from having kids in the house to they're in college now.
Sure.
Or, hey, we're going to downsize, or we're going to move, or
Getting married.
Getting divorced.
Going to college,
Right.
Sure. Or even, yes, as you suggested, getting divorced, loss of a loved one, right?
Okay.
Yeah.
So anything that really disrupts the equilibrium of quote unquote normal.
Right.
Okay.
Right.
And something that I hear in this is it's kind of a mixed bag of there's good life change, there's hard life change, and there's are there any life changes that you would think are kind of just like neutral?
Possibly, but I think what I want to focus on in this podcast is those that might affect us adversely.
Okay.
Because if it's positive, right, really, that's great. Continue on, right? Yeah, super. So let's talk about the things that might impact us adversely and what we can do about that.
Yeah. So, Dr. Mayfield, I'm sorry if you had a question, but...
Well, no, good. I think I have a couple questions, but I think the big one is, as a counselor, what are you seeing coming through the door? And I know obviously we'll use generic ideas and terms just to protect our clients, but what are you seeing as some of the biggest life changes or phase changes that that are making people pick up the phone and call?
Yeah, that's a good question. So I've seen, obviously, like divorce, so a major relationship change.
Okay.
Maybe it's a move. Moving is one of the top 5 changes in our life. And loss of a loved one. Those are some of the major things that I've noticed. And also for some, I think, just transitioning to a new phase of life. We just mentioned, so maybe it's going from staying at home to going to college. That's a good change, but it can bring a lot of anxiety associated with that. So what I like, the analogy I like to use for people is, does it feel like your compass is spinning around and around, right? Does it feel like you don't know which way is north anymore, And that's what I hear a lot of people say when they come in. They just need help trying to navigate through some complicated waters. Yeah. And one of the first places that I encourage people to really pay attention to is, how are you caring for yourself through these times? For some of us, we like to sleep more, or for some of us, we can't sleep at all. So sleep is huge, right? That's huge to helping us think clearly, to being functional the next day. So making sure, our sleep is good. Eating. Are we eating too much? Are we not eating enough? That's going to impact our blood sugar levels. So, the first thing I ask people is, have you had a physical recently? When was the last time you had a physical? Because major life event may trigger something that may already be there negatively.
Sure.
So making sure that we're taking care of ourselves is huge when it comes to major life change.
Why do you think it is that we measure our lives based off of those changes? I think when you ask people about the major events in their lives, or their memories, or whatever, it's based off of these major things versus kind of just the day-to-day joys, highs and lows, and that kind of stuff.
Seems like it has more of an impact, right? In how we remember how we remember what has happened and what's made changes in our life, right? So I moved. That was a major thing that happened with me, or I lost someone very dear to me, that was a major event. I think it's unfortunately just easier for us to hang on to some of those things because it did impact us in some major way, right?
Yeah. I think the thing that goes through my mind too is, so what I heard you say earlier on is that these things draw things out in us or pull, whether it's been there already or it creates these things. Do you find that a lot of people that come in with these major life changes are struggling with new issues like depression, anxiety, fear, or is that kind of been their baseline and it's now just spiking?
That's a great question. I think it largely depends. Sort of what is our predisposition to seeing the world and how it affects us, right? And I think a lot depends on what kind of support group we've had to try to navigate through these things in the past.
Yeah.
What is our resiliency level? And I think for some of us, it's pull your bootstraps up and just plow through. And that works really well for a period of time for some people. But at some point, we can't sustain that level of anxiety or depression.
Right.
So it's finding help to navigate through that. And maybe it's in ways that we're not comfortable doing in the past. And maybe that's why, partly of where we are, this major life event has happened. What kind of resources do I have to help me through that instead of doing it alone?
Well, and I'm reflecting on life changes that I've experienced, my friends have experienced, and I'm thinking about, like, I don't know about both of you, but for me, when it comes to financial things that are happening every once in a while, it all happens at once. It's all in 1 month. The furnace needs this, the cars need registration.
When it rains, it pours,
right. It all adds up into this one time. And it's not like, it'd be nice if it was kind of just like this here and that there. And then, I can take it all in stride, but it all happens at once. And so for that person who their life change has affected so many aspects of their life, where maybe they had a really good support system and now they don't, and they had a place that gave them meaning in their work and now they don't, and like one thing after another. What do you do in those situations where it maybe isn't catastrophic life change, but it is definitely profound life change in several elements of that life?
No, that's a really great question. And that, of course, happens to all of us, right? When it rains, it pours. We can all kind of relate to that. I think it's important to, as you said, sometimes those ways that we got through it before aren't there for us anymore. I like to work with people and really help them find back to themselves. It's like back to their center. So oftentimes we're so focused on external things that help us through. But we're made to survive. We're all resilient to some degree. So coming back to that centered place of where do I find my calm? Where do I find my place of centeredness to help me think clearly and rationally through these things? So I can come up with a way in which to problem solve this. You know? And so some of those those are some of the things that I help find what works for people. Maybe that's through a meditation, or maybe that's through just some techniques to, if they're prone to anxiety, bringing that whole system down, increasing that window of tolerance so that they can find room to breathe again, Spirituality can be huge for some people in finding ways that they can nurture that and foster that for themselves to find that direction again.
So it sounds like it's kind of you're going to lean into the client that's in front of you, the individuals in front of you, and find out what's worked for them in the past, what strengths they have, what hasn't worked for them, and draw things out. So it's not like I think a lot of times our listeners, and I know I want, just give me the 3 points. Give me the 3 things that I need to do to handle a life phase well.
Yes.
And we'll come back before we finish and ask if you have any of those, those practical pointers for our listeners. But do you find it that can be kind of frustrating for people that come in that are going through this and trying to find their calm, their center of what works, what doesn't? Right. How do you encourage people in that?
That's a great question. Life is messy. And relationships are messy, and grief is messy, and giving. I just like to really encourage people to just be present with themselves where they're at and give themselves like room to grow in that space. For example, grief. Let's just case in point, big topic that can affect all of us. You go online, you'll find there's 7 stages. Let's just follow these 7 stages, right? And I'll finally into, where I'm happy again. Well, grief just doesn't happen that way, and it's not linear. So realizing that today or in this moment, I'm feeling overwhelmed, and I need to back off and find that place where I can breathe again, in a more calm way. So a lot of it's giving compassion to ourselves. Like, we want to do it well, yes, but understanding that well in and of itself is just kind of messy and difficult.
When I was pushed back on one of my goals recently, because I said I wanted to do something well, and the individual challenging me was like, well, that is a very broad definition. Well can mean all sorts of things, and it's based on this conceptualization that it should be this certain way. Whereas what I'm hearing from you is doing it well for you may look better as learning and developing the process of how you're going to get through this one time, because it may be different the next time.
Exactly.
But if you're able to say, oh, today I'm very overwhelmed, and so to do this part in a way that's going to work for me, I need to back off of this thing, or kind of take a day off to myself, or maybe I need to push myself into something, and kind of learning ourselves in the process, which can be really exciting. It can also be extraordinarily intimidating.
Sure, yeah, right.
But I think that's where the root of resiliency comes, right? Is that resiliency doesn't mean that you're going to use the same skill over and over again. It means that you're going to take knowing who you are, knowing the situation, and figuring it out, right? I mean, and that's could be a different way each time, but the resiliency piece is going, let's figure it out,
right, and
move through it.
Yeah, and another piece that I wanted to add to what I feel often happens in major transitions is this feeling that I've got to hold it all, right? And I've got to not just get through it by myself, but like I need to control it all.
Sure.
And that alone can bring up so much angst. So helping people realize, like, what part of this problem can I control? What part can't I control? And really, I like almost visualize these buckets of, this is my non-control bucket and this is my control bucket, and so you can put things away in their proper space, and that can really help people navigate through what can seem super overwhelming. Right? Because our tendency is to want to own it all, control it all. And there are just a lot of things in life we can't control.
That's why I love using, I don't use it. I mean, I do EMDR. I know you do EMDR as well. Eye movement desensitization reprocessing for our listeners. But one of the techniques in there is the container exercise. And I love using that for individuals that are going through grief, or some big life changes going, I'm not saying that I'm not going to take this away because you need to walk through it, right? Resiliency is built through, grit is built through walking through the valley, coming out on the other side. But like you said, there's times where we're like, it's just so overwhelming and they want to control it and they want to be able to, it just gets to the point where they can't even move forward because they're so overwhelmed.
Almost paralyzed.
Almost paralyzed, yeah. Right. Well, this container technique is put it away for a while.
For sure.
Take some time to rest, and then pick it back up. And I usually tell my clients, I'm sure you do too, especially with these types of things, we'll pull it out in here. Right. Well, don't pull it back out by yourself. Pull it back out in here. Let me help you. But for our listeners, using that, I think, example of finding people in your life that you can utilize for that kind of support and not do it together, I think is a fantastic tool.
And another note of encouragement for people who are experiencing these kinds of things in regards to support, I think it's important that we have a variety of support.
Yes.
So I have, sadly, talked with people who've been bruised by certain people or certain groups, and I'm just not going to that support group anymore because I was bruised by that, and that is sad, and that is something to work through. But knowing that one person or one group of people isn't made to do it all for you either, right? So maybe there's a part of what somebody can offer that is helpful, but then I also have, so it's having a wide net support network.
When I also, going back to that bucket idea, I really like that because I think in these life changes, we really want to take control over everything because we can make it fixed. And it can be really hard to release some of that into the I don't have control over this bucket. But then you do recognize what you have control over. And you, instead of casting this wide net over the responsibilities that you have, you're snipering in on the one thing that you can control, and you have more power over the situation somehow through that, which is really cool.
It is. And sometimes it's as simple as I can control the fact that I am sitting here right now, and I can breathe.
Totally.
Right?
What would you say to the person, I think that's fantastic, and I think it's a good tool for our listeners and even our clients. But what do you do with the individual that feels so overwhelmed and that it's almost impossible to sit with them and try to help them figure out what is that, like you said, all I can do is just sit here right now. Well, what if I can't? A lot of times the conversation comes around, well, is medication a viable option? And I know all of us have our own opinions. We're not medical doctors, but we still have, some decent training in understanding that kind of stuff. What would you say to somebody that asked that question?
I'm glad you brought that up because I am asked that a number of times from people about medication, and I think it has its time and place. I think some people are very uncertain about should I go take a medication or not, and it really is up to you and you seeking the advice of a medical doctor in terms of doing that. But understanding that it has its time and place. Like it can help you through a period where you feel totally overwhelmed and you can't make it through the next day. If you're not functioning to taking care of yourself or those close to you, maybe you have children, maybe it's an appropriate time to have that talk with your medical doctor, understanding what the side effects are. And I encourage every client, in addition to that, to do their own research and understanding the different options that are out there. And so I think it's definitely worth looking into augmenting what you're already doing with some medication or alternative kinds of therapies.
Well, I always tell my clients too, and I appreciate your thoughts on that, because I always tell my clients as well that medication, there's a time and place, right? And it's not for everybody, and it shouldn't be carte blanche just handed out. But I always tell them too, I said it's going to not take care of the symptoms, it's going to defer the symptoms. So it might provide a relief for you to kind of see things a little more clearly, but those hard things aren't going to go away. And I think a lot of times we think with medication that it's going to take care of those hard emotions. It's going to take care of a lot of different things. And it's like, no, it in some ways it might mute or numb, but it's not going to make them go away. And so, where we say medication's not a fix-all, it has to be, medication and therapy.
Right.
Because we really want to help, work on mind health and renewing the mind and allowing those pieces to affect our physiology, our emotions, our spirituality, all that kind of stuff.
Right.
And a lot of times medication can defer that. So it's not I don't want people to hear, and I know you didn't say that, but not be a fix-all.
Right. It's not a Band-Aid, but it can help in the process.
Right. It's almost like a leapfrog or a crutch, just to get us to a certain point until we're healthy enough. Yeah, I appreciate that, because we do. I mean, I think it's you look at our society and it's the quick fix. What's gonna take care of it, make it go away. Yeah, and we assume by watching commercials and different things that the medication will do that.
Right, for sure. That's a good point.
From commercials and salesmen.
Salesmen and all that kind of stuff.
All the things we should always believe.
So Stacey, what?
Yes.
We're almost finished here, and I'm wondering what are some points or some things, I know we don't want to do the 3-point takeaway, but are there a couple encouragements, a couple things that you would encourage our listeners to do or to try if they're kind of going through this life phase or life change right now that is hard?
Yeah, I think it's important to just remember to be compassionate towards yourself, realize you're going to have hard moments, you're going to have hard days. You maybe want to try some things that you're not used to doing, like seeking help, whether that's through a counselor or through a friend or some kind of support groups that that be compassionate towards yourself, be mindful of how you're taking care of yourself through the rough times.
Yeah.
Sleeping, eating, getting some fresh air, spiritually, how you, if that is important to you, how you are nurturing that aspect of your being. Being mindful of some of those like catastrophic thinkings, I think that comes into play when we go through major life events. So just softening some of that self-talk.
So for example, like catastrophic, you're saying like
Yes.
It's always going to be this way.
Always
It's
going to be
never
this
going to
way.
change.
Now it's the end of the world. Just softening a little bit. Man, this is a really hard day.
Gotcha.
Today really stinks. Or I'm often late instead of I'm always late, right? Just softening some of those things. So, and realize that it's going to be messy. I think that kind of summarizes some of the important points that we've mentioned here today.
Yeah.
Embracing the messiness.
Yeah,
Right.
exactly.
Working through it, growing in it.
My personality wishes it was cleaner, but it's not. So it's okay.
Well, and I think this may be the optimist in me, but there is real beauty to embracing messiness and looking back on it and the accomplishment that you can feel, even if it wasn't done super well. It was done.
Right.
You made it through. You're going to make it through what you're going through right now.
Absolutely. And that's a big piece of it, I think, is helping to maintain that hope for my clients. That's a huge piece of the work that I do with them, and helping them find that sliver of hope that maybe the only hope is that tomorrow might not look like today.
Yeah.
And that might be enough.
That's awesome.
Thank you for coming on the show, Stacey.
Thank you for inviting me.
It's been good conversation. We will see you next week.
Thank you for joining Candid Conversations. If you would like more information, go to mayfieldcounseling.com/Candid Conversations and check out our Facebook page, Candid Conversations with Dr. Mayfield.